I'm here today to introduce a game-changing product called NumBee. NumBee is a device that delivers dental anesthesia without a needle. So I've asked a couple of my colleagues to join me today, Dr. Glazer and Dr. Freedman, and without further ado, let's hear what they have to say about the product.
Well, my first reaction to hearing about the NumBee was, what do you mean giving a needleless injection? How is that even possible? And then I tried it and I became an instant believer. But perhaps even more important, my patients became instant believers.
Over the years, I've heard about many innovative injection systems, and I'm always interested for the simple reason that the biggest fear that patients have when they come to my practice is injections.
But I think it's disruptive technology that can be a game changer. It can be a game changer both from the practitioner's standpoint of being able to deliver painless and comfortable ouchless anesthesia, as well as patient behavior modification, that they will no longer be fearful of coming to the dentist, and that receiving an anesthetic does not have to be that traumatic, oh my God, I have to have a shot.
This NumBee that has no needle, it has no sharp points, it just has a plastic tip that is comfortable.
I typically use it when I'm doing single tooth anesthesia, which is otherwise known as STA. I use it for interligamentary anesthesia, and once I've had the patient comfortable, I can perform operative dentistry, restorative procedures, endodontic therapy, extractions, whatever needs to be done, I can comfortably do for the patient once they have received the anesthesia. The key is getting them to accept the anesthesia in a very comfortable, non-confrontational way.
The easiest way to explain the NumBee to a patient is to totally eliminate the concept of needle from the discussion. This has no needle, and you'll have a comfortable, unafraid patient, both coming in for the appointment and going through the appointment, which will make the whole process easier.
This differs very much from traditional technique in that, number one, topical is not really necessary, because you are slipping the NumBee intrasulcularly up under the tissue, meeting resistance at the periodontal ligament, and then dripping in slowly the anesthetic solution. So A, you're not causing any pressure pain to the patient, there's no prick of a needle to the patient, there's no forcefulness of injection fluid to penetrate and perforate the periodontal ligament, and yet you can achieve single tooth anesthesia very comfortably. I justify the cost of a NumBee in my practice because if I can make patients comfortable, just on the surface of that, they're going to talk about that to family and friends. Invariably, I'm going to generate new patients because I'm providing an ouchless anesthesia.
This is the ideal anesthetic tool that we've been waiting for.